Hi friends, today we will learn about the urinary system. So first I will draw the diagram of the organs of the urinary system. So I have drawn the rough diagram for to easy to understand. So we have two kidneys, the right and the left. These are the kidneys, two ureters, one bladder, the urinary bladder and the urethra. This is the right kidney and this is the left kidney. So the right kidney is slightly lower in position than the left kidney because of the position of liver. These are the ureters. The ureters are located and they are traveled behind the abdominal cavity into the urinary bladder in the pelvic cavity. So the ureters also go back and enters the urinary bladder from behind. So the urine is formed in the kidneys and it is traveled through the ureters and it is collected in the bladder. In men there is the prostate gland. This is the prostate gland, and as the man becomes old there is the enlargement of prostate gland around the urethra. The prostate gland is located and it is surrounds the urethra. So as it's increase in size, it causes pressure and the narrowing of the urethra. So the old men have difficulty in passing the urine. So now we will focus on the kidneys. The outer layer, this is the outer layer. So the outer layer is called as the cortex. The outer layer is called as the cortex and the inner layer is called as the medulla. So it is related to kidney. So it is also called as the renal cortex and the renal medulla. So the urine is formed in the cortex and it is passed into the medulla, and this is the pelvis. This is the renal pelvis where the urine actually gets collected. Through the pelvis, the urine passes into the bladder, into the urethra. So the kidneys are surrounded by the capsule. This is the capsule. It is also called as the renal capsule. This is the capsule. The capsule is the fibrous tissue. This is the renal capsule. This is the renal capsule, which is the fibrous tissue which encapsulated the kidneys. So it is supported by the adipose tissues behind the renal capsule. So this is the normal anatomy and you can say the physiology of the urinary system. Here now we will see the cross section of the kidneys. So this is the cortex, as we have seen. This is the cortex and this is the medulla region. So in medulla, the medulla is arranged in a series of triangular pyramid shapes. So these are the pyramids, the renal pyramids. So the urine is formed in the cortex and it is passes into the medulla and it is passed into the pelvis through these ducts. It is known as the collecting ducts or the papillary ducts. So it is collected into the pelvis. These are the papillary ducts or the collecting ducts. So it is also known as the collecting tubes of the nephrons. The nephron, which is the structure and functional unit of the kidney. So they are striated in nature. The urinary medulla is striated in nature. This is the urinary medulla which is striated in nature. So the urine is collected in the pelvis. This is the pelvis, and it is passed through the ureters into the urinary bladder. This is the ureters. This is the capsule, renal capsule, which is the fibrous tissue. So the kidneys are located behind the peritoneum. So it is also called as the retroperitoneal in location. So above the kidney there are two endocrine glands known as the adrenal glands, which we will see further. These are the adrenal glands, triangular shape in the adrenal glands. So this is the normal anatomy of the cross section of the kidney.